Welcome back to the Deep Dive. Today, we're tackling something that comes up a lot, head injuries.
Yeah, it really does. Even seemingly minor bumps can cause quite a bit of worry, can't they? Especially if you're looking after kids or maybe even colleagues in a small workplace.
Exactly. And there are these sort of persistent questions people always ask, things we hear on first aid courses all the time.
Oh, definitely. Like, is it okay to let them sleep after they've hit their head? That's a big one.
That's the classic, isn't it?
Yeah.
And also, should I be putting a cold pack on it?
Right. Lots of myths, lots of, well, maybe outdated advice floating around.
So our mission today is to cut through some of that confusion. We've looked at reliable UK first aid source material, and we're going to pull out the key advice. Think of this as a quick refresher to boost your confidence for those moments.
Okay, so where do we start? I think the first thing the sources really stress is that any head injury has the potential, to be serious.
Right. You can't just dismiss it.
Absolutely not. So if you suspect anything major, like if someone's lost consciousness even briefly, or they're really confused, acting strangely, or there's obviously significant trauma,
then it's straight to the professionals.
Immediately. The guidance is clear. Call 999 or get advice from NHS 111 or your GP. Don't hesitate if it looks serious. That's crucial.
Okay, vital point. But what about those more common bumps and knocks that don't immediately seem like a major emergency?
Yeah.
What are the basic first aid steps the sources mention?
Well, the general advice covers a few things. First, if there's any bleeding, apply direct pressure to control it.
Standard first aid for bleeding.
Exactly. Then help the person into a comfortable position. The sources often suggest, if they're conscious, having their head and shoulders slightly raised.
Okay.
And then this is really key. You need to monitor them closely, keep a very close eye on them, and of course be prepared for basic life support if, heaven forbid, it becomes necessary.
Monitoring seems to be the recurring theme here, which brings us nicely to that big question, especially concerning children, which some of our sources focused on. The sleep question. Can you let them sleep?
Right, the old keep them awake at all costs idea. Yeah. Well, this is where the guidance is quite interesting and maybe reassuring for many.
Oh.
The sources we looked at, particularly those dealing with kids, actually say that yes, generally it is okay to let someone sleep if they want to after a minor head injury.
Really? So you don't need to keep poking them awake all night?
Not necessarily, no. The thinking is that rest is actually really important for recovery. Sleep is part of that essential rest process.
Okay, that's a bit of a myth busted then.
It is, but and this is a very important but this is entirely dependent on monitoring. Sleep itself isn't the danger. The danger was always potentially missing serious developing symptoms while they slept.
Ah, I see. So sleep is fine if you're checking properly.
Precisely. The sources absolutely hammer home the need for close monitoring, especially in the first, say, 24 to 48 hours after the injury.
So what does close monitoring actually involve if they are asleep? What should you be looking for?
Good question. The sources list specific things. Crucially, you need to be able to rouse them easily. So you might gently try waking them periodically, not necessarily fully awake, but enough to see they respond normally.
Okay. Checking the arousable. What else?
You're watching for any worsening signs. Things like unusual drowsiness that seems more than just normal tiredness.
Right.
Becoming difficult to wake up properly. Repeated vomiting, that's a key one. Increasing confusion. Or perhaps prolonged or unusual crying in a child that you can't console.
Got it. Those are clear warning signs.
They are. And one other detail the sources mention: avoid giving any sedatives unless a doctor specifically tells you to. You don't want to mask any symptoms.
That makes perfect sense. Okay, that really clears up the sleep issue. Now, what about the cold pack? Bump happens, grab the frozen peas.
Yes, the frozen peas defense. Well, the sources do talk about using cold, but it's generally framed in the context of treating bruises or contusions, which often happen with a bump to the head.
So it's for the bruise itself, the swelling maybe, rather than the head injury deep down?
Exactly that. For managing that localized swelling and bruising from the impact, the standard advice often involves rice rest, ice, compress, elevate.
Right, I remember rice.
So, yes, applying icy like a cold pack or wrapped frozen peas to the bruised area is recommended. Always wrap it in something, of course. Don't put it directly on the skin.
And for how long?
One source suggested around 20 minutes at a time for a bruise. It helps limit that swelling and bruising right at the site of impact.
That's a really helpful distinction. It's not a magic cure for the head injury, but it helps with the immediate visible bump and bruise.
Precisely. It puts the cold pack thing into perspective, so really understanding these points from the sources can make a big difference.
Yeah, it feels less like guesswork.
Exactly. The key things are know when it's serious enough for immediate medical help, monitor closely for those specific warning signs if it seems minor, especially if they sleep.
Understand that sleep can be okay with that careful monitoring.
And know that cold is primarily for managing the bruise associated with the bump.
So really, it boils down to being observant and knowing what signs mean. Get help now.
That's the core message. Don't panic with every head bump, but be informed. Know the steps, watch carefully, especially if they rest or sleep, and act fast if those red flags appear. The cold helps the bruise.
It's about empowering you, the listener, to feel more confident and prepared in those situations, whether it's at home or, in a small workplace setting.
Absolutely. That knowledge makes all the difference.
So here's something to think about. If you are being truly vigilant, really observing someone after a head bump, what subtle change in their behavior, maybe something easily missed, might be the very first clue that things aren't quite right. Worth considering.